So today we're going to answer the question, does the pshot actually work? Who doesn't the pshot work for? And what if you got a pshot, but it didn't work for you? What happened? So to answer the first question, does the pshot actually work? Of course it does. If you actually think about what it is, it's platelet-rich plasma. Platelet-rich plasma has all your growth factors, stem cells, and cytokines. These are going to help regenerate tissue, break down scarred tissue, and rebuild blood vessels. How can it not help erectile dysfunction? Makes no sense to me. So the second question is, who won't the pshot work for? Well, if you have uncontrolled diabetes, or uncontrolled high blood pressure, or perhaps you're a smoker, maybe your diet and lifestyle isn't what it should be. Maybe your hormones aren't optimized. I'm gonna give you a little quick insight into my world. So I was seeing a patient who told me he was a diabetic, and he said that he was controlled and that he was taking his medications. So when I drew his blood and I spun it in the centrifuge, I did not see gold apple juice PRP, which is what PRP or platelet-rich plasma should look like. Instead, his was pink and frothy like a milkshake. I will never forget that day, and that will be ingrained in my brain forever. And his issue was uncontrolled diabetes. So just so you guys know, if you have uncontrolled diabetes, that pink frothy milkshake is actually what is feeding the rest of your organs. That's what's feeding all of your tissues, and that's your blood flow. So how do you expect your body to regenerate tissue and rebuild blood vessels if you're feeding it a milkshake through the rest of your body? Make sense?
So the last question we get from guys from time to time is, I did the pshot, didn't really work for me, why would it work now? And there are many factors you have to consider when looking at using the pshot to solve your problem. Number one is, did you do acoustic wave therapy with the pshot itself? So even if you're doing a one-time pshot in the office for sexual enhancement, we always combine that with one of our Nova wave treatments. We've seen over the years that that will benefit over just doing the pshot by itself. Also, maybe the plaque that you've got in your blood vessels has built up to a point where it's inhibiting blood flow. You're gonna need to do more than one acoustic wave to get rid of that plaque before you jump into doing the pshot. Another thing to consider is the quality of the actual PRP kits that you use. Different offices use different quality kits. Now, over the years, we've learned to use the highest quality kits, which do yield the best results. So the quality of the PRP kits has an impact. There's high quality and there's lesser than high quality. And over the years, we've experimented with different kits to figure out which ones yield the best results. And that is what we use, the kits that do yield the best results. So the easiest to work with and show better results for patients. Also, I'll get calls from guys who sometimes say that, oh, PRP is painful. I can tell you from a personal story that I've done a pshot. I've also done PRP for hair. And when I did PRP for hair, I actually asked the nurse who was doing my injections to pull out one of the cheaper kits that we had back in storage. And the majority of my head was done with the higher quality kits that we use. Everything's perfect, pain-free, no big deal. The last 5 injections, they used the cheaper kits, which I'm not exactly sure what it does to PRP, but man, it felt the same way with the needle going in, but it felt like someone was hammering a nail into my head with every injection of PRP. So I can't even imagine that down there as a pshot. So keep that in mind. That is not gonna give you the same results as a higher quality kit will, which is what we only use here. With that said, understanding that higher quality kits yield better results. Well, we learned also that higher quality kits have a higher premium. So cheaper kits don't cost as much. They don't give you the results that you're looking for. So if you're shopping around and you find a deal that's a little too good to be true, keep in mind they might be using a cheaper kit, might be painful, might not give you the results you're looking for. Whereas higher quality kits do yield better results.
So just to recap, you may need more than just your pshot to get the results that you're looking for. Remember to ask, acoustic wave therapy, you should have this done prior to your pshot. Maybe also ask about the quality of the PRP kits that your sexual wellness clinic is using. Also, please remember to have controlled diabetes, control your blood pressure, and please don't smoke. Hormone optimization. If you get your hormones optimized, this entire process is going to yield tremendous results for you. So let us know if this helps, and if you have any further questions, please feel free to leave them in the comments below. If you'd like to see the published clinical research on this topic, please click on the link below in the description.